Hello and welcome to ISCEA Student Chapter.
Podcast. I am your host. My name is Omar Hagras, the president of the student chapter. With us, Dr. Jerry, with his experience in this field, healthcare supply chain. We are extremely happy to have him today. First of all, welcome, Dr. Jerry.
Thank you for having me, Omar. I appreciate the invitation.
Thank you, Professor. Can you introduce yourself or maybe say your background to the audience, to the listener, to know more about you before we go deep in healthcare supply chain?
Sure. I'm Dr. Jerry Ledlow. I'm a professor at the University of Texas Health Science Center at Tyler. I teach in the Master of Health Administration program, Master of Public Health program, and I also teach in the medical school in the Population Health System Science course for the medical students, the MD students. Previously, I've been a doctoral program
Yeah.
director, department chair at two universities, and was dean here at this university for 5 years. And I've returned back to faculty now in the last year. Background in healthcare supply chain, I started in the US
Thanks, Dr.
Army.
Jerry. Can we start with the basics? Can you explain to us what is the
Can you repeat the question, Omar? I'm losing you here.
no problem? Can we start with the basic to explain for us what is healthcare supply chain and why it is important?
Well, the healthcare supply chain is really the system that brings the technology of patient care into the hands of the healthcare providers, the physicians, the doctors, the nurses, the technicians, to help patients improve their health status. If they're injured or if they have a disease, the technology of providing care to the patient is what the healthcare supply chain does. It brings the right item to the right provider at the right time for the right patient reason. That's what the system and healthcare supply chain accomplishes.
Nice to hear that. So, from the disruption or something like that, COVID-19, the pandemic affects the healthcare. So, with how way it affects the healthcare supply chain?
Well, COVID-19 affected the supply chain in many ways. One was the personal protective equipment, masks, gloves, gowns. There's only a certain amount of supply for masks that met the criteria for the COVID-19 virus, the coronavirus that caused COVID-19. And that was an N95 respirator, which is a mask you wear that filters out 95% of airflow and any type of pathogen. The substrate, the substance inside that mask can only be made at certain locations in the world. So there was a run on those N95 masks and other personal protective equipment like gloves. That was the initial issue. The second issue was ventilators. There was also a need for many ventilators within the healthcare infrastructure, and ventilators had to be uh, built, re-equipped, uh, sometimes re-engineered to meet the need, the volume of ventilators that we needed. And then as vaccines and other medicinals, pharmaceuticals became available to fight COVID-19, it energized the pharmaceutical and the vaccine supply chain, and that was a challenge there. What we found was the the fragmented healthcare supply chain worldwide created uh, slower supply chain activity to the point of care, and it created greater disparities to those that were less resourced and less in urban and suburban areas. So more rural areas had more of a difficulty getting supplies during the pandemic, and those that had less pharmaceutical production capability also had a more difficult time. So you saw that fragmentation. So the need for us to integrate more and to have the ability to produce and manufacture basic materials regionally across the world became apparent with COVID-19 and the pandemic that we all faced.
Thanks, Dr. Ray, for this information. Can we go to the next question about the global disruption like the pandemic and natural disasters, and how can healthcare supply chain be more resilient in these cases?
Yes, the healthcare supply chain can be more resilient. Some of which I said in the last question. We need to create diversity of manufacturing geographically, as well as in different countries. We need to create that production capability so that we have more redundancy across the globe. When we only have one or two locations that can produce or manufacture a vital item, and there is a disaster of any kind, it could even be a bad storm that disrupts the logistical functions of the supply chain, that hurts and slows down the supply chain. And when the supply chain is slow or not effective, people are impacted by that. So we need to diversify and create redundancy in the supply chain and get rid of the fragmented holes. The individual providers, the hospitals, the physician offices, they need to have, more than one supplier for a critical item. So having a main supplier and a backup supplier on contract makes sense, but you have to use both contracts, at least to a small degree, to exercise and work through any issues with that contract and with that supplier. So even though you may have a main supplier, having a backup supplier and using that backup supplier at least to a small degree, and I would suggest at least 5 to 10% of your supplies coming from your backup supplier, continues to allow you to work with that supplier and have that backup system. That's what I hope, is that we create that redundancy and that individual providers have a primary and a secondary source for essential supply chain items. That would be very helpful. It's also important for the individual providers, that's the physicians, the hospitals, the surgeons, to have substitute items if possible. So if you know there's a substitute item for an item that you use regularly, it is wise to have a contract or an agreement for that substitute item, and for you to use that substitute item on occasion so that you have mastered the use of that item. So substitute items, redundancy, and exercising secondary contracts, at least to a small degree, all will help mitigate or reduce the impact of natural disasters, either by disease or by climate, or global earthquake or otherwise. So those things will make a difference and help. It's also a good idea to have a really thorough understanding and analysis of your supply utilization habits for your organization. Supplies tend to have a cyclic nature to them. Some supplies are used heavier during flu season, for example. Other supplies are used heavier when people are outside more and there's more injuries. So you have to understand your own supply utilization and make contract changes to meet those supply needs as supply needs go up and down throughout the year.
Thanks, Dr. Ray. It's very important, as you said, to have a pickup plan and to have a substitute items, like you said, and to be ready to have maybe another plan if there is an disruption, and be more flexible to the units. So now we can go to the technology. How was the technology affect the healthcare supply chain? We have a lot of new technology like blockchain, AI, IoT, and another things like that. So how technology exactly affects this sector, healthcare supply chain?
Well, the technology has already started to impact the healthcare supply chain in several ways. One is you'll notice more healthcare is provided on an ambulatory basis in an outpatient environment, not an inpatient, not a patient inside the hospital. They're usually taken care of and provided care on an outpatient clinic type environment. So more things are moving outside of the inpatient hospital to the clinic and even move to the home where the patient is at home. So the use of telemedicine, for example, and pharmaceuticals being mailed to an individual's home, as well as other technological devices in the home, helps move healthcare to where people live every day in their home or at work. So that's one area where technology has made a huge difference. It's moving the care process closer to where the patient works and lives every day, less inside a hospital with long stays, with long inpatient stays. So that's one area. Also, technology is allowing for more and more mass customization of the care process. So you see it in compound pharmacies, where pharmacy formulas are customized for the individual patient. You see it in cancer care, where customized chemotherapy regimens are created. So you will see more elements of the care process and the supply chain assembled at the points of care or near the points of care to customize care for that patient. You see it in surgery with implants, various cardiac rhythm implants, pacemakers, stents. You see orthopedic implants that are mass customized. So you see where technology brings the assembling of the parts of a implant or even a pharmaceutical combination closer to where the patient lives, so it can be mass customized to that patient. The other area where healthcare is changing dramatically is in our ability to innovate and understand the human process, the physiological processes in the body, the anatomical processes, and for us to better customize pharmaceuticals, biologicals, and other devices for patients, which goes back to even greater increase in mass customization. And then the whole idea of technology that's wearable technology. You can wear a ring today that gives you all your vital signs, to include glucose levels, to your phone, sent to your phone. So there's an incredible amount of technology that's being used right now that puts the information at the patient level and shared with a provider that patient sees on a regular basis, so that they can make good decisions about the health of that patient. And I see a huge difference in supply chain in those arenas, because it's going to get closer and closer to the patient, even to include delivering supply items via drone, flying drone, as they are doing today, delivering supplies to remote clinics in Africa, where drones are flying 50 miles or more to deliver healthcare supply chain items to a clinic or a hospital. It's incredible how technology is, impacting every element of the supply chain. But at the end of the day, it's the person who needs the care, or the person who is trying to stay healthy, that will benefit from the technology, the mass customization, and the technology closer to the patient's home and workplace.
That's fantastic, doctor. The technology is a big impact on all things in the supply chain, and with this way in healthcare, it will be different way from the past. Now we can talk about how does Industry 5 maybe affect Industry 5 now start now. So how it can affect the healthcare supply chain, and also Industry 4, it's affect already the healthcare supply chain. So maybe with how way it can affect, and what's the will be new in it, as everything in it has a new concept from Industry 4. So how it can affect the healthcare supply chain.
And what was the impact? What was the element you're saying?
Yeah, the impact of maybe Industry 5. Yeah, we know already that Industry 4 made an impact on the healthcare supply chain. So we can maybe talk about the impact on Industry 4 on healthcare supply chain, or the impact on Industry 5, or the transformation between them.
Well, the biggest thing will be speed.
Yeah.
And you see the good manufacturing standards, the good industrial standards that are used globally, the ISO and other standards, they sort of mimic if you will, our phones and our internet access. 5G. Some people are talking about 6 and 7G now. Different platforms, and it's creating more speed. So the important thing about speed and technology and the information systems behind all of it, if you're not very good at the processes and the manufacturing and the ordering of raw materials and the distribution of your manufactured item to your customers, which could be hospitals, physicians, even patients, the speed of the new industrial standards and the technology systems behind them, you can become very efficient at being inefficient. So if you have problems in your system, you can speed through those problems and create bigger problems for yourself. So you need to make sure that your human process and your decision-making processes are good and within the parameters of the analysis that you're trying to provide for the decision-making process, and that your systems, your information systems, and your manufacturing systems, and your logistics systems match those human processes and complement them, so that you have marks along the way, data points along the way, where you can tell that your system is being efficient. You want to stop inefficiency, and you got to watch out for that, because as systems get better, they become faster. And if your system is inefficient, it will be very fast at being inefficient. So you need to make sure it's fast at being efficient, if that makes sense. So any type of industrial changes really today impact technology and supply chain from a technological software, hardware standpoint, but also where raw materials and semi-assembled parts are closer to the point of use, closer to the provider, closer to the patient, so that mass customization again becomes part of the scenario for better patient care that's customized to the individual rather than one size fits all. The one size fits all only really works in clinical commodities now, like Band-Aids or gauze or cotton swabs. Implants and things that touch or work on a patient, those have to be customized to include pharmaceuticals in many cases, especially when you're dealing with very aggressive illnesses like cancer and other neurological type diseases as well.
Thank you, Dr. Jerry, for this explanation. Now let's dive into the future. Dr. Jerry, what do you think the vision for the next 10 or 20 years in healthcare supply chain?
I think we're in for a lot of change over the next 10 to 20 years. And it really depends on the strategy you adopt. If you adopt a strategy of wait and see what happens to us, then you will be potentially run out of the market because your competitors may use supply chain as lever against you. So you really have to have a strategy to integrate your supply chain. You need to have redundancy in your supply chain, and you need to have the ability to deal with mass customization and to adopt changes in the technology and in the knowledge of the care process. Have a quick way to perform value analysis. That's where AI coupled with human decision making can make quick analysis for your value chain, your value chain analysis and your other supply chain analytical systems, so that you know when to buy, what to buy. And you also need to partner over the next 10 to 20 years. There's a greater emphasis on partnering with providers, physicians, surgeons, and nurses, because as we customize more and more supply items in the healthcare supply chain for patient care, we're going to have physicians, surgeons, and nurses that understand what those customizations are, why we're using those customizations, and we're going to have the ability to incorporate the care process, the caregivers into supply chain. But we'll also have the ability as healthcare supply chain professionals to deliver supplies to the home and the workplace. So the last mile is not necessarily the hospital or the clinic anymore, it's to the home, because more things are being pushed to the home and the workplace where the patient is, where the customer is. So we're going to have to extend the logistical last mile of the healthcare supply chain actually into the hands of the patient who needs it at their home or workplace. That's really what I see coming in the next 10 to 20 years. And of course, the technology and the speed of change will continue to ramp up and move forward to the point where the supply chain we see today will look very different in 20 years. And hopefully, healthcare providers and hospitals and health systems and nations will adopt strategies to integrate supply chain, to get rid of fragmentation, and to have redundancy across their supply chain, and also train and have certification for professionals in the healthcare supply chain, from analyst to manager to even strategy. Healthcare at the defense, the Ministry of Defense level is significant. You have to have a strategy for healthcare supply chain, especially pharmaceuticals and other devices, based upon the needs of the communities and the population you have. If you have an older population, your supply chain will look a little different than if you have a very young population with lots of families and small children. So meeting the needs of those community members and being more integrated and closer to the patient at their home and workplace will be what's going to sort of emphasize the healthcare supply chain in the next 10 to 20 years.
Thanks, Dr. Jerry, for this answer. Now we can talk about the customization of the medical item in the future, and what we can focus on it to make this.
Well, we're gonna need to, partner with the healthcare providers, the physicians, the surgeons, the researchers, the innovators, and the companies and manufacturers that create health-related products. We're going to have closer relationships with them and really invest time together to customize products that are to the best benefit of the communities that we serve, and right away integrate supply chain into that process. And building those relationships will be very important. For example, CEOs of hospitals need to have relationships with their top 20 or 25 suppliers. Part of that conversation is, how do we innovate and create together using our resources together? How do we do that to improve the medical items? We also need to include patients into that scenario, into that discussion, because patients may have ideas after using certain items how to best improve these items. So it's really a supply chain problem from raw material all the way to use that we need to integrate and understand each other's needs and have those relationships and long-term relationships, which is really a strategy. You really need to have a strategy of partnering. So looking at manufacturing companies, healthcare manufacturing companies, pharmaceutical companies that have a similar culture to what you have in your organization, that culture of similarity will go a long way to help you innovate and customize in the future. And you'll be faster at that customization and faster at placing those customized products in the hands of the providers or the patients who need them. And you'll be able to maneuver your supply chain as you need to. For example, you may need to have an area in your warehouse where items are assembled in a sterile environment to mass customize. So you may need to think about, how do I create a sterile area within my warehouse that's approved and that meets the criteria for sterilization, for example. There may be assembly issues in order to mass customize as part of the supply chain. And may need to do that for the hospital, for the clinic, all the way down to the patient's home or workplace, where that item may need to go for the last mile, what they call the last mile in the logistical leg of the supply chain. So those are things that are important, but we need to also make sure that we know how to analyze and assess the value and the importance of things that meet our clients, our customers, our community's needs, our patients' needs the best. And to do that, we need to have that assessment of our communities, but we also need to partner with our communities and our patients, partner with our providers, our physicians, surgeons, nurses, technicians, and the companies that produce and manufacture these supply chain items. So it's really going to be a relationship-based future in order for us to customize more, because even some simple customizations can be a very big improvement to increase the health or improve the outcome of the care process for our patients.
So by that, Dr. Jerry, what skills did healthcare supply chain professionals need to have to compete in the market?
Yeah, they really need a wide variety of skills. One is they need to have an understanding of how healthcare works and the importance of the supply chain in the healthcare process. They need to have analytical skills so that value chain analysis, buy, rent versus buy analysis. They need to have those skills. And they also need to have relationship skills to build those relationships with providers, patients, and your vendors, your suppliers. In addition, they need to have information system skills, project management skills, and people skills. They need to be able to hire and train, coach, and mentor folks to work within the healthcare supply chain that can add the greatest value to the organization. So there's a wide variety of skills that are needed and very unique, really, in supply chain in general. But in the healthcare supply chain space, the healthcare supply chain professional needs to have the understanding of all supply items, from food to radioactive isotopes and everything in between, refrigerated items, climate controlled items. They need to understand the lot batch sequence and expiration dates and how to rotate stock. They need to understand when to buy things, when to sell things, when to cross level. So all those skills become important. So where the International Supply Chain Education Alliance comes in is learning some of those skills within their certification process for supply chain analyst as well as manager certifications. And I strongly suggest that you take those courses seriously, take those certification exams seriously, and get as much certification as you can, and read the healthcare material, not only supply chain, but also what's going on in healthcare in general. But have those relationships with those providers. They'll tell you what's going on in their world: orthopedics, pediatrics, urology, gastroenterology, audiology. They know what's going on, and you can stay attuned by having good relationships with the providers, both physicians, surgeons, and nurses, to make sure that your supply chain stays up to date and resilient to their needs and flexible to their needs so that they can provide the best patient care possible.
That's good, and that's an important point that, as you say, that there is a lot of courses today as International Supply Chain Certification Education Alliances have a healthcare course, so it will be in an important way to know more about healthcare and to compete in the market, as you said.
Correct.
Yeah. And you are one of the, I know that, Doctor, you are one of the course head in the healthcare supply chain in ISCEA.
Yes, I'm the healthcare supply chain standards board chair, and we just had a very good conversation with some of the leadership of ISCEA last week, and even more exciting things are coming. And you should stay on top of your chapter and look at what's coming down over the next few months, because even more important things as supply chain grows and becomes, we're talking trillions of dollars globally in the healthcare supply chain. So how do we get the most out of those resources to get the best patient care to the most people possible? How do we do that? And that's really, in a big picture, what supply chain professionals in healthcare do. And, you know, the more we understand and know, the more efficient and effective we can be. And I would even say the more efficacious we can be, which means what can we do to make the care process even better? Can we get something that's even a little better, a little faster to the provider, to the patient? How can we do that? Can we, you know, use a better information system? Do we tweak and update our demand analysis algorithm? Do we change our safety levels? Do we reorient our stock keeping units that we can, you know, get rid of some things we're not using as much now and change it over to things that we're going to use in the next 6 months more? Do our communities need more of high blood pressure pharmaceutical medicine versus something else? So all those patterns of demand and supply come into that analyst equation, which play also into the manager ability to run a good healthcare supply chain operation, which even goes to the strategic decisions at the senior level of an organization. And that supply chain manager needs to be in those discussions so that strategies can be crafted and developed, and then they can be executed that best meet the needs of that organization and the region or the communities that you serve.
Thanks, Dr. Jerry. Now we can go to the next question about the strategic sources has become a major concern. What should an organization do to improve the source? Because sourcing is a very important thing in anything in a supply chain. So now it's an important thing in healthcare supply chain.
Yes, strategic sourcing is important. And I would argue many health organizations don't do strategic sourcing, they do operational sourcing. What they look at is, where can we get the best deal? Where can we get the best product for the least amount of money? Well, sometimes it's not the money that matters, it's the service or the frequency or the quality that matters. You know, if you can get an item that's 10%, has 10% greater quality, and it only costs 5 or 6% more, and your patient outcomes are better, that's a value decision. That's a value analysis decision. So we have to get good at those things, but we need to find organizations that supply us, distributors, manufacturers, that have a culture similar to what the organization that you work at has. Where can you find cultural integration points? Do they believe in a strong work ethic? Do they believe that, you know, getting rid of errors is a good thing? To make their process efficient is a good thing? Do they believe that, you know, getting the items to the customer when they say they need to get them there, is that an important thing to them? All those cultural issues need to be talked about, and you need to work with that organization to see if you integrate culturally with them well. And if you do, then they're a candidate for a strategic partnership. And a strategic partnership really looks at we're invested in each other's success. We want both organizations to do well, so we're going to find ways to work together to improve each other's operation. And that's the organization that you strategically work with, and you're strategically sourcing, where you innovate and create new products or better ways of doing things, or you repackage things to limit waste, for example. Those are the organizations that you can call and say, I don't want 4 operating chucks in a package. I want 3, because I notice we always throw the 4th one away once we open the package. We only use 3 90% of the time. Well, can you repackage to 3 rather than 4? Those type of strategic sourcing decisions can save thousands of dollars, but over the course of 10 or 20 years, it can be millions of dollars. So, strategic sourcing really needs to be a cultural decision. And then from there, how do we innovate and grow and communicate with each other and grow our relationship so that we both become better at doing the job that we intend to do? That's really strategic. Most organizations in healthcare are still thinking and working operationally. How do I get through the day or through the week? You need to think about how do you get through the year or the next 5 years, 10 years together to both be successful. That's strategic.
Thank you. As you said, that organization must work with the strategic management, as always we said 7 R's: sourcing, right source and right place and right time and right quality and right quantity. So organization must take this case in the first of their in the first of what they do, as already the supplier relationship management must be strong, as the both side benefit from each other, as you said.
Right.
Thank you.
Yeah, and I have I was a co-author on an article in Harvard Business Review in November of 2022 talking about trust and suppliers. I've done a lot of work with a group called Vested Outsourcing, Vested Way, run by Kate Vidasek. That's something to look at, is how they do strategic sourcing, is what they call the vested approach. It's worth looking at. If you look up Vested or Vested Way, there's several case studies. They even have sourcing opportunities where the buyer and supplier no longer have contracts, they just have handshakes, and that's it.
It's really nice thing, and I think that we all must read this article.
Yes, it's Vested Outsourcing, called Vested Way.
Yeah, already I will search for it after this podcast. Now we can, as we conclude, we can talk about the other area of improvement or concern do healthcare supply chain must have.
Yes, I think, and I'll try to keep it simple on this one. As we get more technological, as we use computers more, as we use algorithms and let AI run things in the background, we start to lose the knowledge and ability of picking up a box, reading the label, understanding how to receive and distribute actual items. How do you store them in the warehouse? We cannot lose the skills of hands-on the supply chain items and how you best manage them. So as we learn the technological skills on the computer and the software and the AI and the blockchain, everything working behind the scenes, sort of like perpetual inventory systems, what does it mean on the ground, in the warehouse, on the truck, in the van, where the items are going? Where do we continue to learn those important skills running and using a forklift safely? We cannot forget those basic skills, because at the end of the day, it takes people to move items from one place to the next and to make the decision to do it. And how you do it and how you manage it in the warehouse or on the truck or in the van will make a great impact in the success of the healthcare organization and the healthcare supply chain that you work for.
Thank you, Dr. Jerry. In the end, do you have any advice to give to our listeners about healthcare supply chain?
I would continue to seek certification. I would continue to read. If you can put aside 1 to 2 hours a week to read about what's going on in the healthcare industry and what's going on in the healthcare supply chain, that would be a good 1 or 2 hours every week, well invested in your future. That coupled with seeking certification, like the International Supply Chain Education Alliance certifications, those would be the things I would strongly do. And the more efficient, effective, and good at doing analysis, make buy decisions, value chain analysis, the more valuable you'll be to your organization moving forward as more and more mass customization supply chain items come your way.
Thank you, Dr. Jerry, for sharing your experience and your predicting the future of healthcare supply chain. It's my honor that you be with me today in this podcast. Thank you, everyone, for listening for this podcast. And keep going to search and know more about healthcare supply chain. And if you have any question, you can put in the comment and we can reply on it. Thank you, Dr. Jerry. Thank you, everyone, for listening for ISCE A Student Chapter Egypt podcast. And see you in the next episode.
Thank you, Omar. Thanks for having me.
Thank you, Dr. Jerry.